Today's topic of discussion will be epilepsy. Epilepsy, it is also called as seizure, fits, convulsion, and to tell it in Kannada, ಮೂರ್ಛೆ ಕಾಯಿಲೆ ಇಲ್ಲ ಮಿರ್ಗಿ ಅಂತಲೂ ಇದರಲ್ಲಿ ಅಂತಾರೆ. Epilepsy means as we would have already seen in many patients, there is jerking of all four limbs, jerky movement, then frothing from the mouth, then uprolling of eyeballs, then the patient becomes unconscious, and then after some time the patient although wakes up, but they have tiredness and weakness and confusion for some time. So whenever we see such patients, it is important to take immediate treatment, reach a medical facility, reach a hospital emergency at the earliest, and take medical treatment at the earliest. And there are some things as a bystander or witness which you can do during the seizure episode, in which you have to turn the patient to one side so that the patient does not aspirate, or the froth or saliva which is secreted by the patient, he or she themselves, that is swallowed and goes into the lungs and causes secondary infection, or which is called as aspiration pneumonia, which can be prevented. So the patient is to be turned to one side and just see that the patient does not hurt themselves or injure themselves. So any metal objects or anything which could hurt the patient is to be taken aside and kept safely. Do not insert your own finger or metal objects into the mouth, which is a myth which is thought to reduce the seizure or fits, and some people try to feed them some water, which is also wrong. So these things are not to be done. In such a case, if you try to insert your finger or something, if the patient is biting their tongue and you try to take it out, or maybe avoid it by inserting your finger, the patient may bite your finger and you may injure yourself. So be careful not to do all that. Just turn the patient to one side, just wait for the episode to subside, and if you have one more person accompanying or as a witness, you can ask the person to immediately contact nearby hospital and reach out to if they can get the ambulance, or you can transport the patient yourself. Reach to the hospital emergency at the earliest, because every seizure is important to be treated, and the earliest we treat, the better is the outcome. And the reasons for every seizure, epilepsy is different. Do not assume one episode of seizure or fits or convulsion means something dreaded has happened. It could be due to very minor disturbances in the bodily functions, or electrolytes or sugar variations. So immediately if it is addressed, then recurrences is also prevented, and possibly cure can also be achieved. So there are various modalities of treatment in treating seizure or epilepsy. So timely visiting a hospital is very important.